If you live in the UK, you have probably heard more and more people talking about waiting times. Whether it is for a GP appointment, a specialist referral, surgery, or even A&E, delays have become a common concern. The National Health Service remains one of the most valued public services in the country, providing free healthcare at the point of use, but it is also under significant pressure. Understanding why waiting times happen and learning how to manage your health while you wait can make a real difference to your physical and mental well-being. Waiting times have increased for several reasons. The impact of the COVID-19 pandemic created backlogs in routine treatments and elective surgeries. Many appointments were delayed or canceled, and hospitals had to prioritize urgent and emergency care. At the same time, the UK has an aging population, and older adults naturally require more frequent medical support. There are also workforce challenges, including shortages of doctors, nurses, and support staff. When demand rises and staffing cannot keep up, delays become unavoidable. For many people, the most frustrating part is not just the wait itself, but the uncertainty. Not knowing when you will be seen can increase anxiety, especially if you're dealing with pain or worrying symptoms. It is important to remember that urgent and life-threatening conditions are still prioritized. Emergency care is always available when it is genuinely needed. However, non-urgent conditions may take longer to assess and treat. If you're waiting for a GP appointment, there are a few practical steps you can take. First, be flexible with appointment times. Early morning or late afternoon slots may fill quickly, but mid-morning or midweek options may be more available. Consider asking about telephone or video consultations, which are often easier to schedule. Many GP practices now offer online booking systems, and checking these regularly can help you find cancellations. If you are waiting for a specialist referral or planned surgery, you can contact the hospital's patient advice service to request updates. Sometimes, being proactive and politely checking your status can provide reassurance or even identify earlier appointment options. It is also helpful to ensure your contact details are up to date so you do not miss any communication. While waiting, self-care becomes extremely important. Self-care does not mean replacing professional medical advice, but it does mean taking practical steps to support your health safely. For example, if you are waiting for physiotherapy due to back pain, gentle stretching, regular movement, and posture awareness can help manage discomfort. If you are waiting for support related to anxiety or low mood, daily routines, physical activity, and structured relaxation techniques can provide stability. Physical activity is one of the most powerful self-care tools available. Even light exercise such as walking for 20 to 30 minutes a day can improve circulation, reduce stress, and support immune function. You do not need intense workouts. Consistency matters more than intensity. Fresh air and daylight exposure also support sleep and mood, which are often affected during stressful periods. Nutrition plays a key role as well. Eating balanced meals with vegetables, whole grains, lean protein, and healthy fats helps stabilize energy levels. Staying hydrated is equally important. When people feel unwell or stressed, they sometimes skip meals or rely heavily on processed foods, which can worsen fatigue and mood swings. Small, regular meals can maintain steady blood sugar and prevent additional strain on the body. Sleep is another area that deserves attention. Waiting for treatment can increase worry, which often disrupts sleep patterns. Try maintaining a consistent bedtime, limiting screen use before sleep, and creating a calm evening routine. Even simple habits like dimming lights an hour before bed can signal to your body that it is time to rest. Mental health support is particularly important during long waiting periods. Uncertainty can lead to overthinking and fear. It can help to focus on what you can control rather than what you cannot. Breathing exercises, mindfulness, journaling, and structured daily planning can reduce anxiety. Talking to trusted friends or family members can also provide emotional relief. If symptoms worsen significantly while you are waiting, it is important not to ignore changes. Contact your GP practice again, explain clearly that your condition has deteriorated, and ask for advice. In urgent situations, seek immediate care. Waiting lists are not fixed if your medical need changes. Clear communication is key. Community pharmacies can also provide valuable support. Pharmacists in the UK are highly trained and can advise on minor illnesses, medication reviews, and over-the-counter treatments. For some conditions, they may even provide prescription services under specific schemes. This can reduce the need for GP appointments in certain cases. Digital health tools have become more common in recent years. Many GP practices use NHS-approved apps for appointment management, prescription requests, and accessing test results. These tools can reduce administrative delays and give you more control over your healthcare interactions. Learning how to use them effectively can save time and frustration. Social prescribing is another growing area of support. In some GP practices, patients can be referred to community-based services such as exercise groups, support groups, financial advice services, or well-being programs. These services address the wider factors that affect health, including loneliness and stress. It is also helpful to keep personal medical records organized. Write down symptoms, track changes, note any new concerns, and record medications you are taking. When your appointment finally arrives, being prepared ensures that you make the most of your consultation time. Clear communication helps healthcare professionals understand your condition more efficiently. One of the biggest challenges during long waiting times is maintaining hope. It is easy to feel forgotten or overlooked, but healthcare systems operate on clinical priority. While delays can be frustrating, they do not mean you are unimportant. Patience combined with proactive self-care creates the best balance. Financial stress can sometimes accompany health problems. If illness affects your ability to work, exploring available support services early can reduce additional pressure. Local councils and advice services often provide guidance on benefits and financial assistance. Reducing stress in one area of life often improves resilience in others. If you are caring for someone who is on a waiting list, remember that caregivers also need support. Taking short breaks, seeking help from friends or family, and accessing community resources can prevent burnout. Supporting someone else is much easier when your own well-being is stable. Technology also allows access to reputable health information. However, it is important to rely on trusted sources rather than unverified online forums. Misinformation can increase anxiety and lead to unnecessary fear. Stick to credible, evidence-based guidance when researching your condition. Routine check-ins with yourself are valuable. Ask yourself how you are coping physically and emotionally. Are you eating properly, sleeping enough, moving regularly? Small adjustments can prevent minor issues from becoming major setbacks while you wait. Finally, remember that healthcare is a partnership. While waiting times can feel discouraging, you still have agency in how you manage your daily health. Self-care is not a replacement for professional treatment, but it is a powerful complement to it. By focusing on lifestyle habits, communication, community support, and mental resilience, you can navigate waiting periods more confidently. Living in the UK means benefiting from a healthcare system designed to serve everyone, even during periods of strain. Waiting times are a challenge, but they are not permanent. Taking practical steps, staying informed, and maintaining steady self-care routines can protect your well-being while you move forward toward the treatment you need.